evening broadcast. Welcome to every one of us. I hope we're all doing very great, and I hope our week is going on greatly too. All right, so we're all highly welcome. Today, like we advertised, we are going to be looking at joint pain and low blood pressure. Okay, most times we are all talking about high blood pressure. So today, with some questions that came in during the week, I decided we should handle low blood pressure today, okay? And again, because someone was asking, okay, I have low blood pressure. I hope this supplement will not disturb. I don't know what is happening here and there. So I just decided that today we should do this. All right, so we're all highly welcome to this evening's broadcast. If you're just joining us, you can greet. So I can welcome you to this evening's broadcast. Once again, this is Aging with Grace, your one-stop page for middle-age, women and men to learn about how they can stay healthy and stay away from hospital using natural things they can find around them. And we've done so much. On Saturday, we had some exercises that can actually help if you're having pains, if you're having arthritis pains, especially on your knees. They were so wonderful. Okay, you don't have to jump all around and do so many things before you can get your health back or before you can have the best, that you can. No. So I took time to show us those exercises that we can do. We actually looked at 5 exercises, one for sitting, two for standing, then two for lying, or maybe like three because we actually did more than 5. Okay, so you're highly welcome. So, like I said, today we're going to be looking at low blood pressure and pain. Okay, low blood pressure and arthritis, low blood pressure and some body pains. We're going to be looking at what, why, how, of all that. So you're highly welcome. I just want to finish sharing, okay, on my pages, and then we get going. And if you've not enjoyed, shared, please kindly help me share. I know that there are some pages I might not be able to share now, but then we can do that after. So we're all highly welcome. I turn this, I'll be able to see those who have commented, and then I welcome them to this evening's broadcast. Welcome to every one of us. All right, so Winfriend Otto, welcome. You say you're 57 and you're not on any medication. Please, what should you do? It's just good for you to start some supplements so that you don't get overwhelmed with sickness when you're older. Okay, so I'll advise some menopausal, pre and postmenopausal, and some healthy supplements that you can have, like your fields of green. This just helps you to make sure you have enough greens in your system. Your Active C. This also makes sure you have enough omega-3, and of course our 210 nutrient filled aloe vera gel. So Winfred, I advise you go on these 3, okay? At least because you're not treating any ailment, you just want to be healthy and remain healthy. These 3 are okay, and then you can actually add a forever daily. Okay, this is also a daily supplement that also helps to make sure your heart with these 2 are okay and other things. So if you can afford it, to go by this 4. Okay, Winfred, you can chat me on my WhatsApp number. I'm going to put my WhatsApp number on the comment section now so that you can chat me on my WhatsApp number. My WhatsApp number is +234 703 515 1642. Okay, +234 703 515 1642. That's my WhatsApp number, and there is very beautiful promo going on for this. Okay, buy 2 aloe vera, get 1 free. I'm just giving it out. Now I'm giving it out. I've already bought some cartons and kept that I'll use to dash you. So you buy 2 aloe vera gel, I'll dash you 1. What am I doing? I'm giving back to society. Over the weekend, I just sat and I thought to myself, I've not gone to the hospital to treat malaria for 8 good years. And this was malaria that I went every month. I mean every month. I can give you my hospital. You can go and check it out. By the time I got to Lagos and by the time I started using this product in 2016, I was going to the hospital every month. I paid consultancy every month. Sometimes I pay ahead of time because I know I was coming back. But God being so faithful to me, from the time I started taking aloe vera, I take it till today. I can turn my camera now and show you my pyramid of aloe vera gel. For those of you on Instagram and those of you on Facebook, just give me 1 second. There's no light there, so it's going to be a little dark because that's the other side of the sitting room. You will see my pyramid. Okay? Those, can you see my pyramid? Where is Facebook? Can you see my pyramid? If you look far down, you will see a pyramid of aloe vera gel. I have many of those pyramids in my home, okay, just to remind me of how God kept me away from malaria using aloe vera gel. Okay, I turn back my camera to face my office. I hope I don't lose this. All right, wonderful. I didn't know I was going to do this. I just decided to do it. Thank you for the thumbs up. Thank you for the love. If you come to my house, I will show you cartons of aloe vera gel that I've taken. Now, why am I taking all those aloe vera gel? I just ask myself, how much is consultancy fee? How much is medications that I take? And some days I don't do anything. I have to stay home to take care of myself and do so many of those other things because I will not be feeling fine. But for 8 years, I have not gone to pay any consultancy because of malaria. I've not gone to pay any consultancy or, going from one hospital to the other. That is why I decided to give back by dashing everyone that buys 2 of aloe vera gel 1 extra care. Just for this period. It might end tomorrow. Is while stock lasts. Is while the one I bought last. Once it finishes, that is the end. Anyway, but that's it. So it's Wilfred that brought this. So Wilfred, chat me on my WhatsApp number +2347035151642, and you'll be on your way to also get your own. Hello, Adeshola, Adeola. You're welcome. Good evening. God bless you. Chinyere, Eguta, you're welcome. Goodness, Carlo, good evening. Grace, good evening. So you're all highly welcome. But this is just for those in Nigeria. Of course, there's no way I could have bought to store it anywhere outside Nigeria. So this offer is only for those within Nigeria. Hello, Oluwabumi, Babatunde, you're welcome. All right, so that's it. I've bought that aloe vera for you while stock lasts. So you chat me fast. Buy 2 aloe vera cakes and get 1 free just for today. I'm just saying just for today. So that if it finishes by the time you come, you won't say, where is my own? No, hey, it's a lot of money I'm spending, but I'm giving back to society, being healthy, looking younger, day after day, year after year. I'm looking younger, fresher, and better. Wow. Thanks be to God and thanks be to Forever Living products. All right. So today we're looking at low blood pressure, which is hypotension and arthritis. Low blood pressure is also called hypotension, and it happens when your blood pressure falls below the normal. Okay. That's a reading that is about 90/60 or lower. Some people even have it lower still. So once your blood pressure is about 90/60, you need to hype it a bit, okay? And when blood pressure is much lower than normal, it means not enough blood is flowing to the heart. Not enough blood is flowing to the heart, not enough blood is flowing to the brain and other parts of the body. All right. So blood pressure is also determined by the amount of blood that the heart pumps and the amount of resistance to blood flow in the arteries. Okay? The amount of blood flowing and the amount of resistance from the arteries. So that's what determines the pressure of your heart. So now, if we're looking at what are the causes of low blood pressure, what are the things that will cause low blood pressure? Number 1, dehydration. Okay? When the body doesn't have enough water, the amount of blood in the blood, that is the blood volume, decreases. Remember that we are water and we are blood. So that's if you don't have enough water in your system, the amount of blood will decrease. It's good for you to drink water. I always tell us, measure out your water and keep it down. Okay? During the day, you can have I have different containers I use for water on my bedside. At a time when I noticed I wasn't willing to take enough water, I started drinking from 1.5 liters. So I'll just keep like 4 bottles of 1.5 liters, which will give you 6 liters every day, and to make sure that I finish it. ordinarily. If I don't, in the night I will sit and finish it and sit and do all that we will before I sleep. And it's always better for you to start drinking much water during the day, okay, earlier on in the day. So if you have dehydration, it can cause your blood pressure to drop, okay. And again, another thing, vomiting, fever, severe diarrhea, overuse of diuretics, okay. People who are already on some drugs that are diuretic, if you have overuse of all those drugs that are diuretic, or strenuous exercises, this can lead to dehydration. All right. The second thing is blood loss. When you lose a lot of blood, such as from injuries or internal bleeding, it will reduce your blood volume, leading to severe drop in your blood pressure. Again, number 3 is severe infection. When an infection in the body enters the bloodstream, it can lead to life-threatening drop in blood pressure, which is called septic shock. There are a lot of people who have died out of septic shock, okay? So one also have to be very, very careful. That's why as you're getting older, try to reduce infection, try to reduce injuries. All these ones will help you. And if you're looking for how and what do you do to reduce infection, our Imu blend. Imu blend is very, very fantastic, okay? And of course, again, our aloe vera gel. Very fantastic, will help you to reduce infection. Again, number 4 is severe allergic reaction. Symptoms of severe allergic reaction which include sudden and dramatic drop, will actually lead to sudden and dramatic drop in your blood pressure. Number 5 is pregnancy, okay? Changes during pregnancy cause blood vessels to expand rapidly. And these changes may actually cause your blood pressure to drop. Low blood pressure is common, especially during the first 24 weeks of pregnancy. And blood pressure usually returns to pre-pregnancy level after giving birth. So that one is not really much issue. And that's why you notice that most mothers, when they are going for their antenatal, they usually tell them to make sure they take folic acid, B12 and things like that. We're going to be going very soon to food. Then another thing, the 6th thing that can actually cause is also menopause. There are some people that menopause will lead to high blood pressure. Some people it leads to low blood pressure. Okay, so menopause is another thing that might actually cause people who have that tendency for hypotension to now be increased, okay? The levels of hypotension. Hello, welcome. I can see some people on Instagram. You're welcome. Welcome. Oh, Oluwa. God bless you. Now, number 6 is heart and heart valve condition. When you have heart condition or some heart valve condition, a heart attack, heart failure, heart valve diseases, and an extremely low heart rate, okay, which they call the bradycardia, can also cause low blood. Number 7, which control over. God is so wonderful. God has blessed us so much that the things that are so difficult for one to control, he has or so big, he has put it into your hand that you are able to control it. Now, lack of nutrients in your diet can actually also cause low blood pressure. When you have low levels of vitamin B12, when you have low levels of folate, low level of iron, it will keep your body from producing enough red blood cells and causing anemia. So when your body does not produce enough red blood cell, which is called anemia, it can lead to low blood pressure. It can lead to low blood pressure. So we're going to be looking at some of the ways we can actually naturally improve on our blood pressure if you're having low blood pressure. When it comes to that, I'm going to talk about so many of other things. I think I should greet some people because I can see some more people that came in while we were talking. Okay, all right. So you're welcome, Gladys, Odion, welcome. Goodness, Carlos says, yes, I got mine last weekend. All right, God bless you. God bless you. Thank you. Graceful Aging with Kemi. Kemi, how are you? God bless you. That's one of my global influencers. You're welcome to this evening's broadcast. And don't forget, I'm raising global influencers, women who want to use their talent, their hobbies. I hope Facebook is not knocking me out. Women who want to use their talent, their hobbies, women who want to use, what they love doing, their passion to reach more people. It could be in cooking, it could be in sewing, it could be in talking, it could be in reading, it could be in teaching, it could be in research, whatever you love doing, just join me and I'm going to show you how you can use our Forever Living product with your hobby, your talent, and your passion to reach the world and be able to impact people. So that's the global influencers I'm raising. And if you want to join me, chat me on my WhatsApp number +2347035151642, and I will be coaching you and mentoring you at check time to be sure that I'm within time. Hello, Chibuza. Welcome. Welcome, Chibuza. Joy V said, good evening. Rose, good evening. And Dominic, good evening. All right. So I've greeted those I've not greeted before. Now we look at risk factors to hypotension, risk factors to low blood pressure. Anyone can have low blood pressure. Okay. And the risk factors are: one, age, drop in blood pressure. Okay. Especially after eating, occur primarily in people who are like 65 years and above. Okay, so these are naturally mediated hypotension. Okay, and also we have this neurally mediated hypotension primary, which affects children and younger people. Now, medication is another risk factor. Certain including some blood pressure drugs, risk of one having low blood pressure. And that's why I also said before that if you're taking a lot of diuretics medicine, it can reduce your blood pressure. There's certain diseases like Parkinson's disease, diabetes, and some heart conditions can also increase your risk factor for low blood pressure. Now, there's a question, very, very important question, which was asked last week by some of my people. Once 2 or 3 people asked the same question, then I decide to research and also teach on it. Now, can low blood pressure cause body aches? That was the question, okay? And this condition is called neurally mediated hypotension. Neurally mediated hypotension, and it occurs when there is an abnormal reflex between a person's otherwise normally functioning heart and the brain, and it's sometimes called fainting reflex. So that's what happens. Now, people with this type of low blood pressure may feel lightheaded, and they may feel dizzy, and they may also feel fainting, and other symptoms may also be chronic fatigue. They just wake up and they are tired. Any little thing they are doing, they are tired. Their muscles are aching, their head aching, and then with all those aches and pain, we call confusion. Okay, and symptoms may also happen, especially may happen after being in a warm environment, like if the person just finished taking a shower, a hot bath, or during heat, during summer. Hypotension can happen and the person can have all those pains coming. And again, also, it can also be triggered by position, like when someone has stood for a long time, like people who are into all this service that they stand, like those are traffic wardens and teachers. Okay, and again, also people who do exercises, and also after eating, when one is eating so much at a time, or people who are emotionally stressed, this can also cause it. With this type of low blood pressure, gravity allows blood to pull in the legs. So it will just allow the blood to pull in the legs, and then the heart needs to beat faster to supply the brain with enough blood. But a malfunction causes the brain to tell the heart to beat less, decreasing the blood supply to the brain. And that's why, like when people are having some of these stressful situations, stressful or times that they need to work hard and stand or do strenuous things, always advise they take preventive measures. Okay. Yeah, on Saturday I talked about aloe heat lotion and MSM gel. If you're going to stand for a long time and you might have pains, body pains and all that, make sure you massage yourself after having your bath in the morning with this. It will help to allow better blood flow all over your body. Okay, so you do your a self massage using this or both of them. I usually combine the two. I mix them like a cream, and then I just rub them all over. And then some places that I might not want aloe heat to touch, I use only MSM gel. And some places I want really heat to heat up, I use my aloe heat lotion. And again, what I advise for such people is to have this our drink forever freedom. Put it in a bottle, especially I'm talking to people with low blood pressure now. So if you're having low blood pressure and you need to stand for a long time, you're a service person that need to stand for a long time, have forever freedom. Let it be the drink, your drink for the time. And just like aloe vera gel is also going on its own promo, tap me on my WhatsApp number +234 703 515 1642 so you get to know it. Okay, so you have your forever freedom. You can mix it, of course, if you're having hypotension, mix it with your algae. Algae is also one of the very good supplements. I'm going to mix mine with aloe vera gel because I'm not having hypertension today. All right, so you can just mix it and have it as your drink for the day. Okay, you have it as your drink for the day and you drink it throughout the day. So you have it in your bottle or in a flask or wherever you would like to, hold it, or you have it there and have it on and on. So you just take sips. You just take sips of it throughout the day. It will help to make sure that your blood pressure does not dip, for those people who have low blood pressure. Okay, usually I add my super grain. So I'll just make my drink, but that's it. So if you're having strenuous work and you're prone to low blood pressure, so that you don't get tired, so that you don't get your blood pressure doesn't drop too much, and then everything is going to the legs, and your heart is no more beating very well for it. You take your drink, put your forever freedom in a bottle. You can add your algae like I've said, and then you mix it very thoroughly, and then you take it during the day. Okay, all right. Okay, so does low blood pressure make your legs weak? Why not? Because when you deprive your leg and arms of blood, it will lead to muscle atrophy. And with time, this muscle atrophy will actually hurt and become and it can even lead to also your joints aching you. So it will weaken your legs. When you have muscle atrophy and blood flow is not going very well to your joints, of course, it's going to lead to leg pain. It's going to lead to so many pains in different parts of the body. It's also going to affect arthritis more than usual. Cheers. Join me. Of course. So people say, join me. It's not passing through. Just get one aloe vera gel, two aloe vera gel, and you have one free. So you can join me. That's my joining me that I'm doing for you. All right. So we're going to look at some symptoms of low blood pressure. Some symptoms of low blood pressure. Number one is blurred vision. Blood vision can come out of low blood pressure, and that's why it's good for you to start your eye vision on time. Okay, if you're having low blood pressure, persistent low blood pressure, start your eye vision on time. Confusion is another thing. You're confused, comes from low blood pressure. And usually I advise focus. I don't have my focus bottle out here. Focus, forever focus will help you with that. Help you with depression. Depression also comes with low blood pressure. It will also help with depression, dizziness, fainting, fatigue. All these are symptoms of low blood pressure. Blood vision, confusion, dizziness, fatigue, fainting, feeling cold. You're almost practically always feeling cold, feeling thirsty because of dehydration. When I say dehydration also causes low blood pressure, and then inability to concentrate, nausea, rapid shallow breathing, and sweating. All these are symptoms of low blood pressure: feeling cold, feeling thirsty, inability to coordinate, nausea, rapid shallow breathing, sweating, fatigue, fainting, dizziness, depression, confusion, blood vision. Okay, all these are symptoms of low blood pressure. Now, what are the remedies? What are the natural remedies you can use if you're having low blood pressure? So that's what we go to now. So the natural remedies you will have if you're okay. Let me greet some people on Facebook, those who have just joined. Hello, Rose Onyemobi, welcome. Beatrice Okombe, welcome. We're all highly welcome. I hope we're inviting. Let's share now. And even if your people don't have time to watch now, they will watch later. So let's share, okay? Now, what are the remedies? Share, like, the thumbs up, they make me happy, okay? And tell friends that there is a beautiful promo Aging with Grace is doing now. Don't miss it while it lasts. One, natural remedy, drink plenty water. I've already said this. Make drinking water your habit, okay? Make drinking water your habit. Dehydration can sometimes lead to low blood pressure, and some people may have hypotension even with mild dehydration. So you can get dehydrated by losing water too quickly, and this can also happen through vomiting, severe diarrhea, fever, strenuous exercises, and excessive sweating. There are sometimes the weather is so hot that one sweats excessively. At such times, you need to increase the amount of water you're taking. And like I said, some medications that have diuretic can also cause dehydration. So drink more water by using portable bottled water, like I said. Get some bottles, okay, that will help you, that you will love, that will make you want to drink water. You can just make volumes like this, my sachet of green. Sometimes my husband will put it in 1.5 liter, just this sachet. He will drink it, by the time he's finishing it, he puts another sachet inside 1.5 liters so that it can attract him to drink that water, okay? And if you are the type that you don't like drinking water, set an alarm so that it will remind you to drink water. I'm telling you, it's very serious. Invest in your health. Take care of your health. Take out time to make sure that you live healthy. And then the second thing you need to do is to eat balanced diet. You must eat balanced diet. Low blood pressure and other side effects may occur if you're not getting enough nutrients. Some people eat and they're just eating chaff. And that's why at certain age, supplementation is very, very important. Let me tell you something. When you're younger, the little nutrients you're eating, your body might even try to get it to make out something. But when you're older, you don't even have the thing that is struggling to see if they can get something out of what you're eating. And that's why supplementation is absolutely very, very important for you at this period, okay? Low levels of vitamin B12 can cause hypotension. Low levels of folic acid can cause hypotension. Low levels of iron can cause hypotension, anemia, and hypotension, okay? And this condition happens when your body can't make enough blood and it could now cause your blood pressure to go low. And B12, it's a number one supplement. Man, woman, once you're up to 40 years, you should make part of your daily supplement. And you know what? I love it because it's chewable. This is mine. It is open. And the fantastic thing about our B12 is that it has folic acid with it. So it's 2 in 1. It has folic acid, vitamin B12, folate 667 mcg. So you just have enough. 2 tablets will give you the 1000 milligram of the vitamin B12 that you need. All right. So foods that are high in vitamin B12 include eggs, fortified cereals, animal meats, nutritional yeast, okay? But of course, at this age, some of these foods, they tell you to run away from it. That is why you just need your vitamin B12. And then also you need foods that are high in folate like asparagus, beans, lentils, citrus fruit, leafy green vegetables, and liver, okay? And if you're the type that you don't like vegetables, go on our fields of green or on our super green. This is alfalfa. This one has like 5 greens in one. This has 22 greens and vegetable in one. Okay, so if you can afford this, make it as your drink. If not, you can go on your fields of green. All right. And again, if you're having low blood pressure and you're having arthritis, you're having pains all over, I advise you to have some supplements that you use to support yourself. I've already told us, if you're very active and you walk about, you need your forever freedom. You need your B-Poly, okay? These two will go a long way with your B12, will go a long way. Even if you can't afford or have any, make sure you have these three with you. Very, very important for you. And of course, if you can add AG. This is a little price, but these three will do you good if you're having low blood pressure and you're having arthritis at the same time. All right. So also eat smaller meals. Okay, you can get low blood pressure after eating a big meal, although this is more common for people who are older, 65 years and above. And this happens because your blood flow, you're using it in your digestive tract after you have eaten. Your blood flows to your digestive tract after you have eaten. So normally your heart rate increases to help balance blood pressure. So you can prevent low blood pressure by eating smaller meals, okay? And also limiting your intake of carbohydrates. It will also help to stabilize your blood pressure. And some of the foods that you need to eat and some of the foods you need to avoid, we're going to be discussing as we go along. Number one, stop alcohol. Alcohol drinking can lead to dehydration. So you need to stop alcohol because also it interacts with the medication that can cause low blood pressure for you. Number two, if you're having low blood pressure, eat more salt. If you're having high blood pressure, eat less salt. Sodium helps to raise blood pressure. However, it can also raise blood pressure too much. And that's why you need to control the salt you're eating. So if your blood pressure is not so stable, maybe it goes between high and low or whatever, you need to be very, very careful about the salt intake. And that's why it's not good for you to take processed food that they already put salt inside. Instead, it's better for you to use whole food, process and cook it yourself, and add the salt yourself so you'll be able to manage the amount of salt you're eating every day. This is very, very important. So some of the foods you need to avoid: limit high carbohydrate foods like rice, pasta, bread, okay, that has a lot of carbohydrate. Limit it. And limit excessive consumption of milk and other calcium rich food that you're taking, especially animal milk. Hypotension individuals require food with greater salt content, like I've said. Low sodium meal like frozen fish, unsalted nuts, and seed dried peas are not good for you. So when you want to take your own nuts, if they are natural nuts that you have bought, I prefer you buying natural nuts. You put them in on a frying pan, add a little salt and toast them on fire, or you put them on dryer on your own oven so that you'll be able to control the amount of salt you're putting in. So avoid high carbohydrate food. Take more beans, take more vegetables, green dark leafy vegetables, take more berries. They can help you, and make sure you add your own salt like I've said. Low blood pressure is only a problem if it has a negative impact on your body and it produces some kind of symptoms for you. But if you have experiences like symptoms of loss of consciousness, mental confusion, weak and rapid pulse breathing pattern, it's very, very good for you to get to the hospital. In fact, low blood pressure is more dangerous than high blood pressure, because somebody with low blood pressure can just give up without before you know what is happening. I have one experience that I give God the glory for. As I was teaching, I always teach one woman in Asaba, because she attends my broadcast like this. So when I finished broadcast one evening, she just called me, my mother, her blood pressure is so low. It's so low. What do I do? Everybody's confused. I said, calm down. calm down. Confusion and tension will not help. You have salt. Okay, get salt, get water. I told her the quantity to put in the water, and I said, okay, give it to mama now, now, now. Do you have any strong vegetable food that you can have so she can get energy, and beans? I said, okay. Then when you give her a little. I told her the timing. And I said, keep measuring her, please. Let's get vehicle to rush her to the hospital. It was quite, about, I think I finished my broadcast around 9. So it was between 9 and 10 that she called me. So I said, everybody should calm down. So I kept following up on them. And that first aid, when they got to the hospital, the doctor was so happy. The doctor said, do you know what to do? This one, that one. They called me the next morning and they are happy. Hypotension is not what you take lightly. And I'm going to end up with the symptoms again: blood vision, confusion, depression, dizziness, fainting, fatigue, feeling cold, feeling thirst, inability to coordinate, nausea, rapid shallow breathing, and sweating. Please, if you're having any of this, quickly get your clinic, your doctor, and quickly get someone who can help you immediately. I'm going to take questions and we call it a day. And remember, there's a promo going on aloe vera gel, buy two and get one free while stock lasts. Terms and conditions apply. And again, of course, freedom also is going on a wonderful promo. You can chat me on my WhatsApp number and then we'll be able to get it down to you. Thank you all for joining me today. I so much appreciate you. God bless you. Chat me on my WhatsApp number. I'm going to pin it now. If you need any of the products, chat me on my WhatsApp number. If you want to join the global influencers, chat me on my WhatsApp number. If you want to buy the ebooks, you want to buy the fitness ball, you want to say thank you for what I do, also chat me on my WhatsApp number. Hello. Wow, that's my brother online. You joined us today. Okay, that's my brother. My younger brother. God bless you. Thank you for joining me. Hello, Chinwe Ato Uchechuba. Thank you for joining me. Benny Ogechuku. Thank you for joining me. Beatrice, I think I've greeted you before. Chinwe said, thank you for the teaching. Thank you. I always appreciate. When you appreciate me, I'm happy. It gives me that boost and confidence to keep going on and on. I'm back live every Monday, every Wednesday, every Thursday, every Saturday. See you on Wednesday. We are going to be cooking on Wednesday. What are we cooking? Okay, I'll teach you how you can make home granola. Granola are healthy, especially when you make them yourself. So I'm going to teach you how to make home granola, and then I'll teach you how maybe if I have time, I'll show you how I do my masa. Healthy masa. See you on Wednesday, 4 p.m. Love you all. Bye.